And tonight, Republican members of Congress giving HHS Secretary Sebelius an ultimatum. Turn over documents on the failed launch of Healthcare.gov. Else. Well, what's the or else? Possible subpoena. House Oversight Committee member Congressman Mark Meadows joins us. Nice to see you, sir.
It's good to be with you.
So, what's with the subpoena or the threat of the subpoena?
Well, we just feel like it's time that we get answers, and we've had some hearings, and Chairman Issa sent forth a letter and said, you know, here's a date that we have to live by to get the real results, and if not, then we plan to exercise our rights on oversight and issue a subpoena.
You know, you all are so much more patient than I am. I think that Congressman Trey Gowdy is less patient. He's more like I am because we both were in the courtroom. But the letter that was sent over on October 24th, signed by Congressman Issa, Chairman Issa, says that you'd asked for this on October 10th, and you didn't get an October 10th, so now you're asking again. So I would have just dropped a subpoena now if you hadn't replied.
Well, I like the way you're thinking. What happens, though, is that we expect them to respond. When we send a request, we would expect them to respond. I think Chairman Issa thought that we would get the data, and part of that would come out.
But you didn't.
And we didn't. And so now we have just a very short fuse, and hopefully they'll respond there.
Oh, see, I don't even get that. I wouldn't have that second fuse. You know, I'd say time's up. I have the authority. In fact, I have the responsibility to do the oversight as a member of Congress, the Oversight Committee. And so if you don't do it, you know, well, time's up.
Well, and hopefully the time is running out. We see that the rollout has just been a disaster, and the answers they're not coming forth with. And so we're hopeful that we don't have to get to this last result and we get it here shortly. But if not, we're prepared to go into action.
What do you want? What documents do you want?
Well, it's really more just who made the decisions, what did they know when, you know, because we were told back in congressional hearings back in May that everything was on target. It was all going to work out. We were going to have this rollout October 1st, and there was not going to be a single hiccup. We now know that that's not the fact, and the American people deserve the answers, and so hopefully we're going to see that. But also, what are the things that we need to be concerned about?
Well, she's going to testify next week before Energy, and if I were on the Energy Committee, I'd actually tip her off. I'd send her and say, here's the question I want to ask. I'd say, you know, who made the decision to do the testing and when? You know, how much oversight did you have? When did you tell the president the status of it? How often did you meet the president? I mean, I'd give her specific questions so that she came and had the answers rather than saying, I have to get back to you, I have to get back to you, I don't know, I have to get back to you. I'd tip her off what I wanted.
Well, and I think that's a good idea, and hopefully she's watching this tonight, and so she'll be prepared for those answers, because I can assure you they'll be asked. But the other part of that is why when we had an October 1st deadline and 3.5 years to be prepared, why are we now having a new deadline of November 30th that you've been covering that I don't believe they'll make?
I also want to know who's authorizing the checks. I mean, who's actually saying that the work has been done, the checks goes on. I want to know what kind of contracts they were. Were these open-ended contracts where they could just run up the bill, the programmers, or not? I also want to know if there was a bid for the contracts. I wonder if there's a warranty that they would complete it. I mean, I'd like to know that. An awful lot of taxpayer money's been spent.
Well, between $400 and $600 million.
Well, actually, we heard last night that's gone even higher.
Well, and it could. And as we know from a lot of things in government, they really don't know the cost until after it's already finished. And we need to make sure that when we go with a budget, you know, is it contracted? Do we have some accountability? And what we've seen so far is there is none.
Well, who gets to make the decision how these contracts are offered to people, whether it's a bid contract or not? Is that someone in HHS?
Well, they made some decisions, obviously, over the last 3.5 years.
Does that go all the way up to the secretary?
But also, you know, there's contracting provisions that are there that should be followed, and normally they should be a competitive bid situation. We know that some of those subcontractors actually work for other contractors, and they're now blaming each other for why it's not working.
Well, you know, it's like there's no warranty of work done, and that includes who is monitoring this thing. Apparently no one's monitoring it to make it get done. No one tests it. And all they do is now we'll just do it again and write another check. And it's like really unfair to the American people, whether you're for Obamacare or not.
Well, it's not fair to the American people, and you're exactly right. And they deserve answers. And if we're having this much problem with something that should be simple like a website, what are we going to get when we get the rest of Obamacare?
All right. Well, so you've given till October, I think, 28th at 5 p.m. So I figure that October 28th at 5:01 p.m. if you haven't got the documents, you'll have a subpoena and get them, right?
That's right.
Good.
Exactly.
We'll tell Congressman Issa that. I said that. Anyway, Congressman, nice to see you, sir.
Same here.
Straight ahead, news of a new threat to the entire healthcare system. What is